I did want to show exactly how this worked as far as measurements. This is a goniometer, is what your physical therapist may have. This measures a total of 360 degrees, 180 in each direction, and this is what's used to measure your knee. So for your knee, typically, we recommend in about 2 weeks that you hit about 90 degrees bend. 90 degrees is going to be about an L shape. So this is your thigh, and then your leg coming down. So I'll kind of show you in this position here. Ultimately, when it comes to the knee bend, we do want to try to reach as far as we can back. There are some that will reach as far as, potentially 130. Most of the time, we're hitting somewhere in the 120, probably 125 as far as the knee bend goes. And this is something that your therapist will probably keep track of throughout your recovery. But whenever they refer to the degrees, this is what you're looking at. So immediate goal of about 90. Ultimate goal of probably somewhere around 120, 125. Initially after surgery, you might be looking at closer to 45, 50, 60 degrees, which is out this direction here. So you may not be able to bend the knee very far, and this is maybe all you can achieve. The goal is to grow that as close as you can. We're at 60, 70 degrees, 80 degrees, and then lastly we're hitting close to about 90 degrees. So just something that we're trying to achieve is that gradual progression. The more you stretch, the better off you're going to be with this. For the straight leg, the goal is to get as close to 0 as possible. So 0 is going to be perfectly straight, and that's what you're hoping to achieve after surgery. If you're short of that, they say what the degree is as a negative number typically. So if you're about here, you may be somewhere close to about -8 degrees from where you should be. So the closer to 0, the better. Ultimately, we want to try to hit that 0 mark when your recovery is all said and done. Everyone does recover at a different rate. Try not to get caught up too much in the range, and it will vary from visit to visit. Your inflammation, the swelling, the pain you experience definitely is going to dictate how your range performs each day. But this is something you do want to just make sure you're continuing to progress in the right direction. This is also something typically your surgeon will keep track of as well. There are things, if you don't hit your range of motion goal, that can be done by your surgeon to try to promote it or progress it further. Typically these are a little bit of a last resort and something that usually is not very comfortable. We can talk about that later in one of the other videos. Definitely can't stress enough the importance of stretching. If you're keeping up with your knee bend stretches and you're keeping up with your knee straight stretches, usually you're not going to have any trouble getting that range of motion. Again, there are some things that will affect your range. Genetics can cause it. What your range of motion was before surgery can affect what it is afterwards, and your overall health itself can affect what it was. So just something to keep in mind when you're trying to progress through this journey here.